There is a piece of breaking news that is coming in, and this is coming in on the COVID situation that is developing. Sources are telling us that 4 cases of the BF.7 variant of COVID have now been traced in India. So 4 cases of BF.7 variant have been traced in India. This after the government of India said that there will be more vigilance given what is happening in China. In fact, it is this very same variant that we are talking about that is driving the surge in China. The BF.7 variant is a sub-variant of the Omicron. Now, this isn't the first time that BF.7 is in the news. In October, it replaced variants that were then dominant in the United States and several European countries. So that's the big piece of news that is coming in. I believe I can go across to Dr. Randeep Guleria, the man who led India's fight back against COVID. He's joining us. All right, we'll be going across to him in just a bit to understand from him what exactly this new variant means, and should we worry that 4 cases have been detected with it. Now, there is a massive outbreak unfolding in China. All of us know that. So every government right now is bracing for a possible spillover. China's health industry has reportedly been crippled by this sudden surge. Hospitals and crematoriums are flooded with dead bodies. Pharmacies are running out of medicines, and ICUs, as you know, are short on beds. It's the same situation as it was in mid-2020. But this time, countries are trying to get ahead of the curve. India's health minister has already chaired a key meeting today. He reviewed the COVID situation in India and also issued directives to state governments. Now, let me quickly tell you, before I go to Dr. Randeep Guleria, what the key takeaways have been. Number 1, there is no change in the civil aviation guidelines, meaning that flights to and from China will continue despite rising cases. But sources tell us that international passengers will be tested randomly. Number 2, the existing SOPs for the moment are being retained, so there is no legal compulsion to wear masks in public places, but you have been advised to do so not just by the health minister, but by doctors across the country. Same with booster doses. Not compulsory to get the shot, but if you haven't, you better rush to the nearest vaccination center, because only 28% of India's population have currently got the booster. And number 3, state governments have been asked to set up testing and tracking. They have been asked to send as many positive samples as possible for genome sequences. This will now help the government track new variants of the SARS-CoV virus, including the BF.7, which is wreaking havoc in China. So far, as I said, 4 cases of this variant have been found in India. So the overarching message from the meeting was clear. There is no need to panic, but there is a need to be vigilant. The health minister has also directed all officials to be alert and step up surveillance. He has said that the government is prepared to manage any situation. But one statement from his tweet has stood out. He says COVID is not over yet. Dr. Guleria, thank you very much for your time here on Mirror Now. COVID is not over yet. We are getting a rude reminder once again from China. But can I first come to you with a question that is plaguing the minds of all Indians? What is this new sub-variant of Omicron that we are talking about? Because 4 cases have now been detected in India. Is there reason enough for us to at least start panicking? Thoda sa.
So I think this new variant, which you said rightly said BA.7, has been there for quite some time, and it has sort of replaced the older variants. It has been seen in India also. But I think our situation is different from that as far as China is concerned. This variant, we know, has the ability to cause spread more rapidly. And also it has the ability to have what we call immune escape mechanism. So these 2 things are making it spread rapidly in China. That is that it spreads, it's more infectious, and it is also getting people who have already had COVID or have had the vaccine are getting the infection. But our situation is different from that as far as China is concerned, because our vaccination rates are high. And like you rightly said, I will encourage all those who have not taken the booster dose to come forward and take the booster dose. But we have good immunity both because of vaccination and because of natural infection. China didn't have that. They had a zero COVID policy. And because of the zero COVID policy, a large part of the population, especially the older age group population, is still vulnerable. They have not been exposed to the infection either because of natural route or through vaccination. The vaccination uptake in the older age group is very low in China. And we don't know about the efficacy of the vaccine because it's the local vaccine which has not been evaluated at the international level. Because of that, I think it's important for us to understand that we have good amount of immunity. And what we're seeing B.7 is that although it is more infectious, it is causing more disease, it's not causing severe disease, it's not causing more hospitalization, and it's not causing more death in that group of people who have got vaccinated or who have had past infection, because the immunity in them is able to really prevent the infection from spreading and causing severe disease. But having said that, we need to be vigilant. We need to have COVID appropriate behavior. We need to push for vaccination. And I would say that all those who have COVID-like symptoms should get themselves tested using RT-PCR, because genome sequencing cannot be done by the rapid antigen test. So get your RT-PCR test done, and genome sequencing should be done. We should also have surveillance in hospitals. Is there a surge in admission in hospitals because of COVID or because of influenza-like illness? We need to evaluate that, and that type of surveillance needs to be done along with genome sequencing.
Dr. Guleria, can I ask you what you mean when you say, please get yourself tested if you have COVID-like symptoms? I ask you this question because COVID-like symptoms are much like flu-like symptoms.
Correct. So that is very true, because currently a lot of people have flu-like symptoms and they say this is just a common flu, but the flu-like symptoms and COVID symptoms are the same. But in the current situation that we are in, it's important that if you have fever, which is going on for 2-3 days, if you have cold, cough, and body aches, then if you can, you should come forward and get yourself tested. Our testing is low right now. People are not coming forward and getting tested because they feel that the pandemic is over. This is just a seasonal cold and cough that we have. We don't need to get tested. Many of them, if they get tested, they turn out to have COVID, but it's a mild illness. But our concern is that in case it is a new variant, then we will not be able to pick it up, because unless you get tested and you do genome sequences, we will not know what is happening. So the solution is to ask people to come forward to get themselves tested. And the second is to do surveillance from hospital point of view. Because even if it's a mild illness, we still are comfortable. But if it's a more severe illness leading to hospitalization and people coming into the hospital, we must pick that up early so that we can take action. But currently, whatever data we have suggests that in the vaccinated population or those who've had past infection, the B.7 is usually not causing that severe infection.
Dr. Guleria, then from a citizen's point of view, this is the question I will ask. I have flu-like symptoms, I have COVID-like symptoms. In the last 2 years, I know exactly, 2 years ago, we were all mortally scared of getting COVID. Now we know what to do. We know that we need to isolate ourselves. We know that we don't need those 100 steroids and dawais. All we need is paracetamol, that too if you have fever, right? Now, if I know the protocol already, why can I as a citizen, even if I think I have COVID, not just lock myself in my room, isolate myself, take my paracetamols, get better in 5-6 days and resume my work? Why should I go through the pain of getting tested, sir?
Good question, because it has two parts. One is my responsibility as an individual, and my responsibility for the nation or for my fellow citizens. As an individual, you're very right. You just isolate yourself. You take paracetamol, keep yourself well hydrated. You can take your multivitamins, and by and large, you will become all right. We are not seeing a lot of people having severe illness, fall in saturation that we were seeing in the past. But from the society point of view, it's important for us to know what is happening in our country. If you have COVID, which is the variant that is causing it? And is it some new thing that is happening, and should we be vigilant about that? So that is why I'm saying that as a responsible citizen, it may be worthwhile to get your RT-PCR test done. It's not going to change your treatment strategy. It's not going to make a big difference in terms of what you're going to do. And we are not in a situation where you will be picked up by the authorities and put in a COVID care center or put in the hospital. You will just have to do what you rightly said, isolate yourself, take your symptomatic treatment. You don't have to take steroids or remdesivir or any new drug, and you will become all right. But I think it's important that we also become responsible, because if we don't get ourselves tested, how will we know if a new variant has entered into our country? Because we won't have enough tests to be able to do genome sequencing. So people coming forward is one area, and the other is hospitals have to be vigilant and should take samples of all patients who get admitted with flu-like symptoms or who are sick and could have serious infection which mimics COVID. That testing should be done. But that I think is also very important.
So you're saying get tested in national interest. It may not, it may not alter your treatment protocol, but do it in national interest. So I would recommend what Dr. Guleria is saying. Sometimes, you do things for yourself and sometimes you do things for your country. This is the time to do things for your country and get tested. Dr. Guleria, then, my next question to you is this. You and other doctors have argued that our immunity is pretty good. Almost everyone in this country has got COVID. And why do I say that? I don't know what the latest government statistics say, but I know that every family I know has been infected with COVID. Almost everyone, almost every member. So that means that most of us, 99.9% of us, already have that immunity from the infection. Secondly, most of us have also now got our double dose, 2 doses. Many, I know many haven't got their booster doses, but at least 2 doses we have. Does this mean that we have herd immunity? Will this constitute herd immunity? And if it does, are we all safe? Are we safe? Are we going to be fine irrespective of what happens in China?
Immunity is an interesting concept because it depends on what is the circulating virus. Yes, as far as COVID is concerned and the circulating virus is concerned, I think we have herd immunity because, like you rightly said, most of us, either with symptoms, without symptoms, with mild symptoms, have had COVID, and a large number of us have had it with the Omicron variant because that was very widely spreading in the last 1 year. So yes, we have had herd immunity. We have had herd immunity to some extent to the circulating Omicron lineages which is there in our country. But suppose a new variant comes where the variant is very different, and therefore that will affect the whole concept of herd immunity. So we have herd immunity to the circulating strain, but a new strain will need new degree of protection, and we may not have herd immunity because immunity will wane over a period of time, and the variant may also change with time. So we could say that yes, we have herd immunity to the circulating strain, but this may change with time, and that is why we keep on getting infection with flu or with flu-like symptoms every year, despite almost many of or large population getting it flu every year. So that concept will happen because the virus keeps changing. It has what we call an antigenic drift. It will keep on mutating and will obviously try and escape that so-called herd immunity.
But if that is the case, and if the virus keeps changing, what is the guarantee that the vaccine or the booster shot that we go for will protect us? Because that, the vaccine was made for a particular kind of variant, and we know that COVID over the last 2 years has mutated to an extent where I think it's almost unrecognizable now, sir.
So that's true, and that is what we do with the influenza vaccine also. Every year we take the flu shot, which is of a different strain, depending on the circulating strain. And in the West now, we have a bivalent vaccine for COVID, which is available, which covers the older Wuhan strain and also covers the Omicron strain. So as we move forward, we will have new vaccines which will cover the circulating strain and not the older strain. And that will be something that will be done on a regular basis for some time so that we are ahead of the curve as far as the virus is concerned, and our immune system is given a boost for the new circulating strain rather than from the older strain, which is no longer existing. But current data suggests that we still are able to get some degree of protection, even with the older strain, because this is where it has originated from. But I do agree with you that over a period of time, we will have to keep changing our vaccine based upon the circulating strain.
Dr. Guleria, I have 2 quick questions for you before I let you go. First things first, does India now need to change its guidelines? For example, it is still not mandatory to wear masks in airplanes. In fact, no one is wearing any masks anywhere right now. So A, do we need to make it mandatory once again? And secondly, do we need to seal our borders with China? Has the time come? Because we know, sir, that what happens in China doesn't stay in China.
So 2 things. One is I would encourage everyone to wear a mask. It's difficult to make it compulsory we can try that, but I think it's important that people realize that wearing a mask protects you against various infections, including influenza. And in a city like Delhi, it also protects you against air pollution to some extent. So it's important that we all encourage, especially the high risk group, the elderly and those with comorbidities, to wear their masks. I think it's difficult to close borders with China because the infection will spread from other parts. You people will take transit flights and from China go to Europe and then come to India or go to the Middle East. So that policy will not work because it's not going to be practical to do it.
Last question. You've seen the assessments that have come in by way of experts on social media that are saying that 90 days are going to be critical for China and the world. Over 60% of its population could be infected with the new variant. What is your professional assessment, sir, with all those dire predictions that are currently being made?
So my take on this is that I think it's not that bad. We will have more infections in the winter months, but it's not going to cause more severe disease. You see, we need to differentiate between that. In the population which has good immunity because of natural infection or because of vaccination, we will see infection because immune escape is going to be there. But we are not going to see more deaths, more hospitalizations, unless there is a dramatic change in the virus. And we've not seen that over the last 1 year. So it's unlikely that that will happen. We need to be vigilant. We need to monitor more closely. But I don't think we can say that the future is looking very dark. I think we need to be vigilant, but be positive as far as COVID is concerned. I think the worst is behind us.
The worst is behind us. That's a positive note, sir, to end this interview on. Thank you very much for your time here on Mirror Now. Always a pleasure to have you and listen to your wise words. Thank you very much. So what Dr. Guleria is saying, it's time for you to mask up. It's time for you to get the booster shot. And it's also time for you not to panic. This is what is coming in just now, and we are revisiting the breaking piece of information that we got at the top of this show. Sources are now confirming that 4 cases of the BF.7 variant have been traced in India. Now, this is the very same variant that is driving the surge in China. The BF.7 variant is a subvariant of Omicron. But this isn't the first time that this variant is in news. In October, it replaced variants that were then dominant in the United States of America and several European countries as well. Let me try and see if we can go across to our reporter who will be joining us on the story. All right. I do believe that Mayank is with us on the story. Mayank, is the Health Ministry saying anything on 4 cases being detected with the B.7 variant? I ask you this question because this variant has been around for a while now.
Well, absolutely, and that is the version coming from the Health Ministry as well, that this, although BF.7 subvariant of the Omicron variant is driving, another wave in China of COVID-19, but that should not sound, alarm bell in India, because this has been, as you rightly pointed out, this has existed in our country for some time now, but it has not, overwhelmed our health system, because remember, Omicron has been in our country since the start of this year, and it did not create the kind of overwhelming pressure on the healthcare infrastructure as the Delta wave did in the mid part of 2021. So Health Ministry is very much optimistic about that point. Okay. But what they are mainly focusing on is random sampling of the individuals who are coming from overseas country, because what they are focusing on, as Randeep Guleria rightly pointed out, that people might be going from China to other countries and then coming back to India. So the Health Ministry is focusing on that every airport which has international arrival station, so random sampling will be done, so that if any passenger turned out to be a COVID positive one, so there can be genome sequencing to find out that if indeed they are infected with the BF.7 subvariant of the Omicron variant. And apart from that, the Health Ministry has also emphasized mostly on early detection, because what they have said, that we are learning from the sources, that India has always been trying to get ahead of what could be in terms of COVID pandemic, because what the policymakers are believing, that if India has to see another wave, it will be too late to handle. That's why they are trying to preempt the situation, and that's why we have seen a high-level review meeting chaired by the health minister himself.
Mayank, can I quickly ask you a question before I let you go? A quick question for you. Could we see guidelines being changed soon, for example, masks being made mandatory, etc.? Is that something that the health ministry is considering right now?
At this point of time, it seems unlikely in very near future. But, the chief of the ANTAGI, Mr. N.K. Arora, said that, there should be a precautionary wearing of masks by the people, especially in crowded place, and that there should be, COVID appropriate behavior, taken care of by the people going to the crowded places. So as of now, it's all precautionary. The health ministry is not in a mood to raise, the alarm bells for the population, because what the health ministry is also focusing on, Shreya, is they are believing that the wider the immunization coverage in India has been very wider, at least very much more. It had a scope of vaccination in India has been very much wider than what has been in China, and they are banking on immunization and also the booster dose to combat whatever comes India's way. So as of now, in immediate future, it seems unlikely that the mask mandate will come back, but health ministry is keeping a close eye on China, and nothing can be ruled out.
Okay, we'll leave it there for the moment. India needs to be vigilant, India needs to be prepared, and India needs to put in strict protocols in case the health ministry thinks that, that trouble is coming. That was the scientific